Hey, everybody, this is Alex Merced, and if you're listening to this, you're either listening to my podcast, um, Thinking and Feeling Libertarian, or The Opinions of Alex Merced, one of the two podcasts. Subscribe to both, because they don't always have the same content. But what I want to talk about today is something that I think is relevant to both podcast streams. And this is the idea of a quote or a sentiment that on Twitter that is, the idea was basically that if there was universal healthcare, a universal basic income, and universal education, that it would unleash a creative whirlwind that would make free markets, capitalism, even stronger. And there's a lot tied up in there. There's things that are sort of implied and things that aren't. And I want to pull this apart a little bit. One of the parts, the fundamental sentiment, which I think is accurate, and the policy implications, which I think are not what this sentiment generally thinks. Okay, and so first I start off with the idea that, hey, if more people had a better education, if more people had better healthcare, or better health, really better. I mean, at the end of the day, healthcare. The point is I think a lot of people get lost in, hey, I want to go to the hospital. But at the end of the day, like, if people took better care of themselves, they would need less health care. So fundamentally, what we want is people to have better health. Now, yes, there's going to be people on the edges who have healthcare needs that are, independent of whatever healthy practices they live in their own life. But most people, the amount of healthcare they use is really relevant to the amount that they take care of themselves. But if everyone took better care of themselves, everyone was better educated, and everyone had more resources to have leisure time, meaning time to think about doing other things and just survive, this would probably lead to a lot more people thinking of business ideas and being able to work together on new projects and whatnot. The question is, does just writing a check and saying, okay, hey, we're going to pay for all healthcare, all education, and provide everybody with income, does that actually do that? Okay, that's the fundamental thing. People just say, hey, if I have a policy that says this is true, no more hunger, doesn't necessarily mean you've gotten rid of hunger. Okay, yes, if there was less hunger, that would be a better world, and a world that I would certainly want to move towards. And I want a world where more people have access to education, access to healthcare, and access to prosperity in the form of income and wealth. But it's not something that you necessarily can just say, hey, there's a policy that's going to give people that, and that necessarily is what happens. And that's what I want to talk about. Okay, there's a lot of factors. Okay, yes, there are countries that do provide a lot for their citizenry, and to a variety of effect. Okay, some better than others, some have better outcomes than others, and again, some of them are making trade-offs. They're not investing as much elsewhere as they are in, there's trade-offs they make. It's not like they're just getting, it's all a bonanza for them. A lot of those countries are higher tax countries. They are countries who might have been run into resource issues later on. I mean, there's a lot of, right now, if you go to England, there is a lot of political rancor over the national health system, in how to deal with sort of like a tougher funding for that system over time. Because these systems generally don't stay at a particular cost. So even if you figure out how to pay for them based on today's numbers, oftentimes once you implement these systems, they become more expensive over time. And then everyone's worse off when basically everyone's on one system and that system can no longer work. Now everyone's on a shitty system instead of some people on a better system and some people on different shades of gray. Okay, that's sort of the trade-off. When you have diversification, okay, and that's essentially what you have when you have market-based provision of a good or service. Yes, not everyone's going to get perfect, but more people are going to not have the worst. Okay? Generally, when you have everything in one bucket, whatever everyone gets is what everyone gets. Okay? And again, then if you've seen politics lately, politics can be very, very schizophrenic. Okay? We've seen the type of sort of just wild political swings that have happened at the national level here in the United States over the last few years. Now imagine if that was controlling the entire healthcare system that everyone was on. Okay, if you were someone who believed in universal healthcare, can you imagine what your healthcare would look like under 4 years of Trump, and then now in probably another 4 years of Trump, and having those wild swings and unpredictability in what your health services will be, and lack of control over them? Because once the federal government has control, you as an individual have a lot less say. Okay, because at least right now you can, you know, your employers may offer you. Unfortunately, employers are oftentimes how you get healthcare. That I also have a big issue with that. But that gets into the history of how healthcare sort of evolved in the U.S. But at least generally, you might have a couple different options of plans and levels of those plans, and you can always seek another job and possibly find, depending on, and again, of course, generally if you're more skilled, you're probably going to have more negotiating power. That's a given. So yes, there's always this sort of disparity at the lower, or let's say less the more competitive labor markets. You're going to have less negotiating power. What does that mean? There's a lot more people who can do the thing that you do. Okay, so in that case, it's hard for you to say, hey, I want X, Y, and Z. But the beauty of it is like you're not stuck there. Like you do have the ability to learn, and it's much easier today than ever. Okay, I mean, I was someone who was working one job and totally switched careers and literally went months without an income, and very little savings to switch those careers to be much better off, heavily relying on just using sort of online education. Now, can everyone do that? No, especially if you're someone later on in life, that's much harder to do that, because even if you learn the stuff, it's just generally going to be naturally harder to go from to start at entry level and necessarily have the time to go the life cycle to go through a cycle. But that these are just sort of real life challenges. Okay, and I think some people are just like, while these challenges, while we should always aim to be better to each other and try to treat each other more as individuals, and try to aim for a culture that mitigates and minimizes these types of challenges in people's lives that come from sort of how we see each other and how we treat each other. Again, you can't just wave a wand and dictate it away. But there's also just the resource limitation. At the end of the day, like if you say, hey, I want education for everybody and we're going to pay for education for everybody, it doesn't raise the number of teachers. Okay. And, so then what happens, you create a situation where you're trying to figure out, okay, how do you scale better education? And then this, of course, leads to certain things like, okay, finding the best teachers and delivering sort of on-demand lectures and stuff like that. But then what happens is that this inevitably leads to the need to find a way to offer a higher income for these sort of rock star teachers who basically are educating everybody, which also inevitably leads to sort of a lower income for your average teacher, who's going to become more of a facilitator, teaching based on these. And for the, education status quo, that's not something that's probably going to fly with most teachers, because it just is what it is. And also just in general, like that's an ideal world. If they do kind of come to that conclusion, more than likely they'll just hire more teachers, and basically what happens is once you hire all the good teachers, then you hire the less good teachers, and then eventually you start hiring all the bad teachers. And this is something that kind of already happens with teacher shortages in many states, partly because teachers aren't paid enough. And again, when I say teachers aren't paid enough, is this that okay? Generally you take a look at like more private institutions, high quality teachers get paid better. But the problem is oftentimes when it comes to like public sector, you end up spending a lot of money on administrators, a lot of bureaucracy. So oftentimes all the higher incomes go to people who are basically oftentimes wrenches in the educational process than those facilitating the education process. And it's just an unfortunate reality of bureaucracy. Okay? Because again, government isn't private property. It's not there's no individual who's accountable. So you have to create extra layers of accountability. So anything that's public is naturally going to become bureaucratic and top heavy, administrative and cost heavy. Just the inevitability either of that, or it becomes sort of kind of corrupt and lacking accountability, because since there is no layers of accountability, people just do what they want and get bribes and stuff like that. It's like there's no happy in between. And again, I'm not saying it can't be done better. There are examples of governments that, governing bodies that have worked well. This isn't, again, basically being sort of someone who's for generally less governance. It's not so, not less, for less things to be in the realm of what government does. Doesn't necessarily mean I don't think there's ways to have governing bodies that work. It's just I think institutions that are smaller and more closer to the people that they're affecting are going to work better. So, city, local, state governments, and, even state government, a lot of states are really big. So even state governments oftentimes already are kind of like making lots of mistakes. So I'm generally I'm not like a states' rights guy or whatnot. Oftentimes it's just like, even from two towns that are right next to each other, like just so many different differences in the economics and geography. And you have cultural differences. You have economic differences as far as the kind of industries that they have, the different types of also geographical needs. Like if you're in a mountainous region versus let's say Alaska, your needs are completely different. Okay, so the more sort of higher level you legislate, the more a lot of those differences kind of get lost in the mix and become harder to account for. So oftentimes you just don't get ideal solutions. So just to kind of recap, one, in the United States in particular, covers such a large land, any kind of universal healthcare, universal education, universal basic income is just not going to work because it doesn't capture those local differences. For example, with the universal basic income, you come up with an income number. Oftentimes they'll probably base it on a median income or whatnot and try to kind of come up with some sort of formula based on that, I would imagine. The problem is that median income, in some places, hey, if they were guaranteed that, life's going to get a lot better. Great. Okay, but if you're places like New York and California, you're still struggling. Okay, you're and even with and that's even with an extra additional full-time job, you're probably still struggling in many places. Okay, it's there's sort of big picture. There's a lot. The little picture gets lost, and then you create policies that sort of disproportionately benefit people. And then also there's just geographical differences. Just over time, okay, for a variety of different reasons, chances are in areas that are socioeconomically worse off, even if you provide education and healthcare for everyone, you're going to find worse hospitals and worse schools in those areas. Okay, this happens for a couple different reasons. One, with schools, you see, because it's paid from local taxes. So basically, places that get less local taxes have less nice things. But also, oftentimes people don't want to work in less nice areas. So oftentimes you don't get the same labor pool available, the same quality labor pool available to you to staff these institutions. So again, worse health. So poor areas, even if you say, hey, you're going to pay for everything, are probably still going to have worse healthcare outcomes because you can't force people to go work in areas they don't want to work. Okay, we're not going to get into forced labor. That's just not where things should go. Okay, so so basically there's this just sort of the natural these natural factors, funding factors, also just sort of sometimes there's just resources that aren't available in certain areas that are going to affect the outcomes. You can't have every medicine and every medical, if you ever watched The Good Doctor, there's a lot of random stuff the hospitals, that the best hospitals have, offhand and ready to go to treat people that are not going to be available at 90% of hospitals. And same thing with universities. Not every university is going to have every facility. It's just not practical and not economical. Okay. Now, so yes, people with, going back to the sort of the fundamental thing is I do believe if more people had a better education, more people had better health, and more people had a better economic foundation, that would offer sort of a more positive situation for everybody. Okay, it's a positive externality because, everyone is just in a better position to contribute more. And, there are backstops. But again, you take a look at a lot of countries that provide their own national health care. Oftentimes, most of these countries are about as big as a U.S. state, if not smaller. They're dealing with a lot less geographical differences, a lot less cultural differences. So a lot of these things that kind of create these sort of frictions are easier. It's much easier to kind of create a one-size-fits-all policy. Okay, and that's just something that's just not going to change in a country the size of the United States, and whose individual states are so big and diverse, geographically, culturally, economically, etc. Okay, so and then even then, most of those countries will oftentimes run into sort of fiscal challenges in managing this in the long run, because again, those programs may have good outcomes in the beginning, but they tend to grow in cost because things don't get cheaper and populations don't get smaller typically. And then people get older, so so people might have a lot of kids. That's going to increase like the education costs. People might, a lot of people might be retiring. That increases like the cost on that end. That it becomes harder and harder to maintain. So even if you're seeing good benefits from it in the short run, they don't become sustainable. And that's the thing. You want to try to create an environment where you have better education, you have better health, but it's sustainable because it's done in a way where the costs are diffuse and the trade-offs are minimal. How do you do that? That's generally like ideally a free market environment, because in a free market, you have different people in different areas coming up with different solutions, trying out different trade-offs, and you're discovering sort of which trade-offs work. Okay, now theoretically, if you did want to do some sort of interventions, I guess that would be anything that can help facilitate people who normally can't participate and evaluate different alternatives and be part of the market as strongly, kind of helping them be part of those markets. Okay, so that way they can do that. Now, again, some of these markets in the U.S. are pretty bonked. Like, if you take a look at the healthcare system, it's the way we pay for it, the way it's not a market by any stretch of the imagination. It's just really bad. So there's a lot more thought that kind of has to kind of go into how do you unwind that and get that more into a dynamic where there can be more proper feedback. I do think there has been some step. I do feel like around the edges, you're starting to see a little bit more market forces there that have yielded to sort of, I think, but it's more been like the technological delivery. And so you're seeing like a better technological delivery that's definitely helped access. Like, I feel like it's, things with like teledoc and whatnot make it easier to just, if I need an appointment, I can get an appointment kind of thing. But doesn't necessarily like, optimize costs. Like, costs are still quite a challenge. But yeah, that's the thing. Like, basically, the idea is you want to try to facilitate individuals going out there and making more individual decisions for purchases when it comes to health, education. Give them more, find ways for them to have more opportunities, or at least more flexibility to go pursue higher incomes. Okay. And this can be done, doesn't have to necessarily be done through a policy act. This could be done through, like, for example, I create all sorts of free online educational material, particularly when it comes to like programming and data engineering and whatnot. And I put it for free on YouTube. And I know many people who've been able to like change their careers, not solely based on my content, but using some of my content to make it easier to understand a lot of that stuff. And now they're better off. And that's something, if everyone is able to kind of help facilitate that, help people make better, make it easier for them to make better choices and facilitate them moving their life in those directions, you can have a world where there's more health, more education, and people generally have a higher level of income to create that bountiful benefit you get when you have more people better off. The problem is we just have so many historical mistakes and decisions that were made, and also just a lot of the division that current politics, and that's the other thing, like, the more power you derive in one place, in this case, let's say the federal government, the more vicious the fights get for that power. And we've seen that, like, basically politics has become increasingly divisive, and it's divided everybody, and that makes it harder for people to work together and help each other. Okay, they bring that charitable spirit to the table because everyone just kind of hates each other, and that's because the way you win elections is you convince 51% of the population to hate the other 49. That's all you need to do to win. Okay, you don't need 52%, you need 51%. So you figure out how you can slice and dice 51 to 49, that you can create a message that says, you need to vote for me because you should be scared at 49% of the people. Okay, and that's politics these days, and it's depressing and sad. So in that case, again, that's more reason why we need to look to each other for solutions and look to not necessarily, hey, what solutions can we ask somebody else to do, but what kind of solutions can we bring to the table on a small scale? Again, if 1,000,000 people each helped three or four people, that's 3 or 4 more people who are better off. And if those people help 2 or 3 people, you can see that whole pay it forward effect. Okay, that's how you actually diffuse the cost of improving everyone's situations and creating those beneficial whatnot. Okay, like the whole, just being out there and focusing on how we can do good for each other goes a long way. And that's always been sort of like the message I want to get across. Like at the end of the day, like you can be progressive, you can be conservative, you can be libertarian. At the end of the day, one thing we can all agree on, regardless of what your policy views are, is that if we can reach out to each other and give each other a helping hand and try to look at each other more charitably, instead of trying to look for reasons to not like each other and be angry at each other, but try to focus on helping each other live the best life we can live, okay, you're overall going to find that a lot of these challenges become a lot easier. And we can do this at a much lower expense. We need to start realizing that we have to do this together and not just have someone else to do it that's who theoretically represents us all doing it together to do it. So, yeah, those are my thoughts for today. So, overall, you have a great day. And, if you're wondering who I'm voting for come November, I'm voting for Chase Oliver. Chase Oliver is a good guy. I know the guy. Great guy. Totally worth voting for. Good character. Nice guy. Someone I can sleep at night knowing that they're thoughtful and coherent. And if you don't know who Chase Oliver is, Google Chase Oliver. Great guy.